Assalamualaikum warahmatullahi wabarakatuh. Okay, what are we gonna do here today? So today, we're going to presenting and discussing what have we learned about cystic fibrosis. But before we start our talk in this session, please allow all of us to introduce ourselves first. My name is Puti Radhitya.
My name is Nabila Aulia.
My name is Meishita Jasmine Sahira.
My name is Tyas Fachrunnisa.
My name is Salwa, Nisrina, Sahira.
And for the beginning of our discussion, I would like to explain some introduction into our topic. Cystic fibrosis is the most common single gain hereditary disease among people of Northern European descent. It is caused by a mutation in the gene encoding the cystic fibrosis transmembrane conductance regulator. It's some kind of a protein. Then, cystic fibrosis patients have hypersaline or extra salty sweet, have trouble digesting food, and symptoms at the respiratory systems.
Next, I will tell you about the basics of the CFTR protein. The cystic fibrosis transmembrane conductance regulator, or CFTR protein, helps to maintain the balance of the salt and water on many surfaces in the body, such as the surface of the lung. The CFTR is called ion channel, who moves chloride ions from inside the cell to outside of the cell.
So, how is CFTR made? The CFTR protein is made up of 1,480 amino acids. Once the CFTR protein chain is made, it is folded into a specific 3D shape. The CFTR protein is shaped like a tube that goes through the membrane surrounding the cell, like a straw goes through the plastic top on a cup. DNA in the cell nucleus provides instruction to make proteins. The CFTR gene contains instruction to make the cystic fibrosis transmembrane conductance regulator, or CFTR protein. RNA acts as a template to make proteins. RNA is created by matching the coded instruction in the DNA. This process is called transcription. Ribosomes are tiny molecular machines that read the instruction in the RNA and use them to make the CFTR protein. This process is called translation. Once complete, the CFTR protein moves through the cell to the cell surface. This process is called trafficking. Once at the cell surface, the CFTR protein functions as a chloride channel. This channel helps maintain the right balance of fluid in the airways.
Cystic fibrosis transmembrane conductance regulator or CFTR genes mutation are categorized into 6 categories. Mutation categories 1, 2, 5, and 6 result in an absence or reduced quantity of CFTR at the cell membrane, whereas mutation in 3 and 4 affect the activity of CFTR at the cell membrane. Class 1 mutations are associated with the greatest disruption to CFTR-mediated chloride transport in general. Chloride transport gradually increases through the remaining 5 classes.
For more explanation can be seen in the following video.
Cystic fibrosis, CF, is the most common inherited disorder that leads to shortened life expectancy, especially among people of Northern European origin. CF is caused by mutations in the CF transmembrane conductance regulator, CFTR, gene. The CFTR protein encoded by this gene functions as a chloride channel, allowing passage of chloride ions across cell membranes. Because chloride drives water movement, CFTR plays an important role in regulation of water and salt balance in secreted fluids such as mucus and sweat. Mutations in CFTR lead to production of thicker mucus in various organs, causing obstruction and other problems. CF patients also have saltier sweat. Cystic fibrosis is inherited in an autosomal recessive manner. It occurs when a child inherits one mutation of the CFTR gene from each parent. The parents typically do not have the disease but are carriers. They carry one mutated gene and one normal gene. More than 2,000 different CFTR mutations have been identified so far, with the most common, deletion of the amino acid phenylalanine at position 508, accounting for about 70% of all cases. Different mutations affect gene functions to different degrees. The severity of the disease depends on which mutations a patient has. The most severe form may manifest in the first few days of life when the meconium, the first stool of the newborn, is so thick and sticky that it is unable to pass, resulting in bowel obstruction, an emergency that requires immediate attention. On the other hand, patients with a milder CF may not show symptoms until their late childhood or even adulthood. Usually, the later the symptoms manifest, the milder the disease. CF is a multisystem disorder, but it affects mainly the digestive, respiratory, and urogenital organs. While respiratory insufficiency is the leading cause of mortality, digestive symptoms are usually the first to appear. In the digestive system, obstruction of bile ducts may lead to poor fat absorption and possible liver damage. Thick secretions may also block the pancreatic duct, preventing pancreatic enzymes from reaching the intestine. In addition to poor digestion, this leads to accumulation of digestive enzymes in the pancreas, which destroy pancreatic tissue, causing inflammation or pancreatitis. Damage of the pancreas may also result in shortage of beta cells that produce insulin, causing insulin-dependent diabetes, a very common complication. Other digestive symptoms include abdominal distension, intestinal obstruction, and intussusception, in which a segment of the intestine slides into its adjacent segment. In the lung, thick mucus cannot be readily cleared and becomes an environment for bacteria to grow and cause infection. Chronic infections, together with the resulting overwhelming inflammatory response, eventually leads to airway destruction. Thick mucus may also block the airways. Common respiratory symptoms include chronic cough, wheezing, and recurrent pneumonia. In the urogenital system, CF may cause infertility in men and decreased fertility in women. CF is part of the newborn screening test in many countries. The screening typically involves an immunoreactive trypsinogen test and a DNA test for common CFTR mutations. If the result is positive, a sweat test for chloride content is performed to confirm the diagnosis. Once diagnosed, chest radiographs, pulmonary function tests, and arterial blood gas analyses may be used to follow disease progression. There is no definitive cure for CF, but early diagnosis can help manage the condition and increase lifespan. A number of medications and therapies are available to help prevent or control lung infections, clear or loosen mucus from the lungs, prevent or treat intestinal blockage, and improve digestion. Lung transplantation may be required for severe lung damage. Recently, new modulator molecules have been developed to directly interact with the mutated CFTR protein to correct its folding and facilitate its function. Notably, a combination of 3 medications has been proven to effectively manage CF caused by the F508 deletion.
Okay, for the next slide. Problem: when mutation occurs in the gene copy, ion transport is impaired and results in the buildup of thick mucus throughout in the body, causing respiratory insufficiency. In normal airways, the ESR airway surface liquid is hydrated by a combination of Cl- secretion and Na plus absorption. Meanwhile, in CF airways, reduced Cl- secretion and Na plus hyperabsorption causes ESL dehydration that favor mucostasis. CFTR also blocks another channel called the epithelial Na plus channel or ENAC. ENAC allows sodium ions to leave ESL and enter the respiratory epithelium. So that if the CFTR is damaged, sodium flows freely from the ESL into the cell.
I think that's all we can talk about the cystic fibrosis. We're so sorry if there are mistakes, and then wassalamualaikum warahmatullahi wabarakatuh.